going to talk about a hand X-ray. We have our little patient here. Again, for anybody, adult, infant, everybody, you can use a small cassette. Again, if you don't have one, have no fear. You can do it. Okay? So we want to make sure, so patient's comfortable in daddy's lap, which is perfect. If they get too wiggly, they can snuggle them, hold them kind of in a bear hug, whereas you can hold the extremity. So to make sure that you get the hand in the middle of the cassette, just like so. And I'm trying to keep it oriented. We can straighten his arm to the cassette. There we go, just like that. Is that more comfortable for you? You see how he's putting his hands just like this? So I want to make sure that we separate the fingers. Just like that. Just perfect. Good job. All right, so central ray. It's going to be right on that third knuckle there. I know that's not the technical term, but that's how we're going to go with it for today. And I put my marker just like that. It's really easy again on the hands to get really close. Oh, hold your hand out. Separate them. Separate them out. It's really easy to get like really close with a collimator, be it here or, you know, like so. Okay, we want to make sure that we capture some of the wrist, about the distal third, but we don't want, you know, the whole forearm. We don't need that. Okay, so we're going to separate those fingers one more time, just like that. See how close that is? And see, he moved, he wiggled, right? So I want to make sure. It's going to look like a lot, but I promise you that's a very standard hand X-ray, just like that. So that's your AP. Again, making sure that the tube to image receptor distance is 40. We're going to take the hand and we're going to rotate it externally, like so. You can have a positioning sponge that, you know, has the hand rested on here. I've used, on little infants, I've used tape across the fingers. And keeping that tape attached to the cassette, I've taken this side and oblique their hand just in the tape itself. He's old enough that he should be able to hold this view. What I like to do with this little one, okay, just relax. What I like to do with these little ones is I'll go ahead and rotor on my machine so that I'm almost ready for my X-ray, and then quickly take my X-ray out. Hold it right here. Hold it just like that. Ready? Good job. 1, 2, and hold it. 3, boom, take my X-ray. Right? So little ones are a little trickier. You'll have to come up with some troubleshooting things, or again, using positioning sponges are perfectly acceptable. Laterals can be a little more challenging. We do have lateral positioning sponges as well. So hey, can you go like this for me? Put your pinky, I'm not your pinky, your index and your thumb, good, just like that. Okay, this is where we start, okay? And he's at a really tough age, so a positioning sponge would really help. So you want to make sure that you can fan these fingers out and keep the lateral, all the metacarpals in the lateral position. Move my marker. This is pretty good, actually. Just like this. I'll position his fingers in just a second. All right, good. Yeah, so you want to try and keep them fanned as best we can, just like that. We're going to relax just a little bit. And I would hold it, hold it, hold it. Ready, rotor, 1, 2, 3, boom, take my X-ray. Okay? If they are an infant and you want to sort of single out a finger, that's really helpful. Infants, a lot of times we have to do in a more lateral aspect, just again putting tape on their hand. We try and do this. If we can, we'll try and fan the fingers as best we can to get the view of the fingers that we need to see. And again, older kids, just have them do, you know, an okay sign, and then you just have them relax. You can have that, just relax their thumb and their index finger, and trying and keeping those fingers in a fan position. If they're older, or some little ones come in with bracelets, take them off. Rings, take them off. When they have acrylic nails with bejeweled, you know, gems on them, make a note of that. So that our radiologists know that that's just on the artificial nail. It's not something that's embedded in the tissues. It's an easy explanation and causes a lot less headache whenever we have to go fish through the chart. Okay, so just make notes of things that they can't or won't take off. Makes it a lot easier for us. And that's how you take a hand X-ray.